In Health News tonight, a close-up perspective of that Ebola outbreak from a well-known expert who is now back home here in Connecticut.
Well, that doctor just returned last weekend after being right there on the front line since June. News 8's medical reporter Jocelyn Memento live in our New Haven newsroom tonight with more on that candid conversation with the Southern Connecticut State University professor. Jocelyn?
And Darren, Dr. John Wangu was in Africa as an advisor to the World Health Organization. He tells me Ebola is no longer an epidemic. It is now a pandemic.
Anxious and uncertain faces in West Africa, the impact of a faceless enemy, the Ebola virus, now in 5 countries.
And that's where the infection occurred.
Epidemiologist and Southern Connecticut State University professor Dr. John Wangu
Right there is Guinea.
is back from an extended stay in the infected regions, advising the World Health Organization. The skin on his hands.
Look at my finger, it looks disgusting.
Reacting to extensive wear of protective gloves and clothing. Chaos, he says, is rampant there.
People are looking for places to run and go and secure themselves because they are afraid not knowing when they can get it and how they can get it.
Despite the high rate of deaths, he points out people are surviving.
We still don't understand. There is nowhere in the literature, nobody has done any work that can explain why.
Dr. Wangu says the experimental drug given to 3 Americans and others has been highly effective, but only when given early on.
Because in contrast to those who had the full-blown disease, they don't make it when you give them the experimental drug.
While Ebola is transmitted through contact with bodily fluids, Dr. Wangu says that also includes sweat.
You can find it in people's skin. It can be right there on the skin. You can find it in tears.
Isolating the sick is key to slowing down the spread of Ebola, but that has been challenging in the countries affected.
It's very difficult in that kind of situation to be able to do that because you can go for miles before you find a hospital.
Dr. Wangu says Ebola can be contained, but 2 things have to happen. Developed countries must provide more effective support, and the leaders of the African countries impacted must welcome it. Darren and Ann?